All right, wonderful. Well, thank you all for joining the third event in this Resilience Coffee Chat series for Earth Month. We are thrilled to have you here. Maybe I've seen some familiar faces in there. Maybe you joined one or two or other of these events. We're really excited about this one on our campus community. And I am on the wrong slide there. Wonderful. So our first two events we had on climate resilience. The first was on infrastructure on campus, the second on our environment. And we are kind of rounding that up with our campus community, some more of a focus on public health and how climate is going to impact us here on campus and what we can do to adapt to those changes and make us a bit more resilient. I'm going to turn it over briefly to Kate Nelson to give an introduction of climate resilience, and then we'll get going with our speakers. So hang tight.
Good morning. Don't get dizzy there. Good morning. I'm Kate Nelson. I am the Director of Sustainability at the University of Minnesota Twin Cities. Thank you and welcome to a Monday morning Earth Day coffee chat. What a way to kick off the week. I think we're done here after this. Like we just, we're good. You can go home and rest. So it's great to have our speakers with us. This is a very broad topic and there are so many different angles to come from, even from what you see in the themes that we've had. So I'm introducing this today because as many of you might be aware, but maybe some of you not, we have been completing our climate action plan, not just on the emissions mitigation, but also on climate resilience. And so a really fantastic work group has just wrapped up and we are in the final design of our climate resilience plan for the university. And the three categories that you see in the coffee chats are exactly how we did the breakdown. Although I must say with the group that we had, there was so much great intersectionality between understanding campus community and the needs of the environment and back and forth, and the intersection with infrastructure and energy systems as well. And so we did a vulnerability assessment of each of these areas, which helped us understand which areas to focus our plan on the most. We also did a strengths assessment. There are some wonderful things happening here that we also need to build on and understand as we move the climate resilience plan forward. And so we're just about to launch into implementation. I actually already have some interns who are even getting us started. And you will see over the next 9 to 10 years how the University of Minnesota Twin Cities addresses climate resilience. And one of the most, perhaps I would say the most important feature is our campus community, understanding our vulnerable populations for many different reasons, and also understanding a big focus of our work has been on essential employees, those who need to do their work on campus and can't work remote. And so that has really framed out our plan in this area. And so, but today you'll get to hear from some experts in this field, and I hope you can ask some great questions at the end. So I'll turn it back to Carly. Literally.
All right, eyeballs back on me. Okay, wonderful. So we have 4 really amazing speakers today that are all going to speak on this aspect of climate resilience and how it kind of intersects with our community and health. So I'm super excited to introduce these 4 panelists. So how this is kind of going to work is we're going to give each panelist about 5 to 7 minutes to introduce themselves and their work. And then we are going to open it up for questions and discussion. We want this to be a nice informal discussion. You don't have to raise hands. We're just going to kind of chat and ask questions to our panelists. So I'm fine with our panelists going in this order, but I'm also fine with going in another order. So we have Dr. Christy White from our medical school here on campus. We have Dr. Kyle Hill from the School of Public Health. And we have 2 Doctor of Nursing Practice Program students, Melissa Thone and Pang Lor. So we have really wonderful, diverse group of folks and perspectives to hear from today. So if it's all right with you, Christy, maybe I will kick it off with you.
Yeah, that's totally fine with me. Good morning, everybody. I am Christy White. I work as a clinical health psychologist here at the University of Minnesota in the Department of Medicine, Division of General Internal Medicine. And what that means, a lot of people don't know what health psychology is specifically, so I'll start with a little bit of background about that. So I am a clinical health psychologist, which means as a clinical psychologist, I treat general mental health concerns like depression, anxiety, stress, grief, anger, those sorts of things. But I do that all within the context of somebody having some sort of medical condition or physical health concern. So the interventions that I provide when I'm seeing patients really focus on health promotion, disease prevention, chronic disease management, helping people navigate the stress of living with illness or injury, hospitalization, the stress of having a change to their medical status. And so I use psychological principles and psychological interventions to help people make meaningful changes within some sort of health context. So that's kind of what I do clinically. And the majority of my work, my position is divided 85% of it is clinical, and then 15% of it is academic scholarship. And in my academic space, I sort of grew up academically as a stress researcher. So was a big focus on the stress health connection. I did a lot of work in what we call cardiovascular psychophysiology. So thinking about how do our stress responses put us at risk for greater cardiovascular risks or health outcomes, both from kind of a physical perspective. So how does stress kind of exert its force on us physiologically, but then also how does stress affect our health from a behavioral perspective in terms of how we respond to stress in ways that may put our health at greater risk. And so it was really my second year of graduate school that I found a way of merging my clinical, environmental, and academic interests, where we can really think about climate change and environmental events as a very specific type of stressor that certainly has health implications. And so helping then people navigate through the stress of these environmental impacts on both their physical and mental health. A lot of my work since I graduated graduate school has been in the implementation space. So doing a lot of work on promoting green healthcare practices. I'm actually pretty new to the university space, so I've only been here for about 2 years as faculty. Before I worked here at the university, I was at Hennepin County Medical Center and did a lot of work there around implementing green healthcare practices and how can we think about building what we know about climate change and health into the hospital setting. So an example of that was one of the clinics that I worked with, we built a community garden, both for the patients and for the staff who were working there. Since I have been here at the university, a lot of my work has been focused a lot on implementation, advocacy, helping people within my field of behavioral medicine to kind of move forward and creating some maps for people who are interested in moving into the climate change and health space. So that's a little bit of a summary about me and what I do. And I'm happy to turn it over to Dr. Hill for the next introduction.
Thank you so much, Christy.
Good morning, bonjour, everyone. My name is Kyle Hill. I guess we're just going to launch right into it. I was excited for today. I have my coffee, ready to chat. Yeah, Christy has her coffee. Yeah, so my name's Kyle Hill. I'm an assistant professor in the School of Public Health in the Division of Environmental Health Sciences. I just started this year, September 1st of, 2023. And so just, getting my legs under me and feeling very, very much settled here at the university. I guess tracing it back where my journey with this started, kind of similar to Christie's actually, or Dr. White's. It was, I would say even earlier on, geez, like when I was young, I started to, think about some of the issues my own community was having. Namely, I think some of the youth that we were experiencing, some of the, and I grew up on a couple different reservations, and what I noticed was a lot of a lot of our youth, a lot of us were struggling because of a lack of connection to our culture as Anishinaabe. That's where I'm enrolled. That's where I'm from, is Turtle Mountain. And on my dad's side, I'm from Siston, Wapton, and Cheyenne River Sioux tribes, Dakota and Lakota Sioux tribes, respectively. But what I didn't realize back then was all the things I was noticing were a result of disconnection to culture and land. And those kind of traditional activities and knowledge sources that really kind of stewarded our people here in North America, pre-contact, pre-colonialism, and so now, fast forward, I took a very similar trajectory. So I started out in clinical psychology, and went back for my Master of Public Health. And while I was there, I took several classes in like environmental biology, or environmental health biology, climate change and health, and climate change and mental health. And it soon became apparent that the things that I was looking at, the things that I was working on were rooted a little bit further upstream. So when we think about prevention, I guess what really kind of shed light, or the light bulb turned on, was the idea that, okay, I'm doing all of my work as a psychologist, as a clinician, very, downstream, really looking at things like secondary and tertiary prevention, and these are all of these conditions in my, I primarily and almost exclusively have worked with American Indian communities my whole life. And so all of the conditions that we see, whether that's trauma related, mood disorders, substance use, all of it is related to kind of almost like a lack of something that was there previously and that has proven to be very beneficial for our people. And so, as I moved on, I think my focus shifted more towards public health and climate related environmental work. And of course, I've been involved in like several, resistance efforts in Standing Rock, in DC, for the Line 3 pipeline. And so along the way, along that trajectory, there were several like flashpoint experiences where my outlook changed. My life essentially changed, and it became one of I'm doing my best to treat these issues that we're experiencing, this dis-ease, if you will, instead of disease, because they're very, very I think treatable, through primary prevention. And I shifted further upstream. So things now, what I'm looking at is how Indigenous traditional ecological knowledges, so the same things that I would look at as a clinician to say, if we buffer these, use these as buffers or as protective factors, this is going to be really important for your mental health and for your health overall. But those same practices are also what we consider important for are scientifically for things like climate adaptation programming. And so if you look at things like the Intergovernmental Panel on Climate Change or the Fifth National Climate Assessment, within those documents, you'll see a very heavy focus on the potential for Indigenous traditional knowledges within climate adaptation or mitigation programming. So I sit here today and I think about that and I'm like, holy smokes, this is, of course, rooted in some really awful experiences and the tragedy of colonial subjugation that is, plagued our people, and it still continues to, and but if we look at, what does it look like to decolonize, whether that's health and wellness or decolonize policy, that means I wouldn't say going towards like pre-colonial or pre-contact, but looking what works now. And I think that, being solution focused and strengths based, that's where the work has led me. We recently published a couple manuscripts, one on traditional knowledges, climate change, and health, and um, published one on even here, like a case in the Twin Cities of what rematriation of Indigenous lands might look like for Indigenous communities. And that was a perspective in the Journal of Climate Change and Health. And I could link those both in the chat as well. And so right now I have a project that's just starting. I'm actually going through the IRB, which is going to look at the I think more contemporary, but also looking at Indigenous artists and their connection of their pieces, of their artwork to environmental issues, whether that's climate change or environment, period, because Indigenous people are so interdependent with our territorial homeland. So we think about spirituality, our traditional activities, our cultures. You wouldn't find any community gathering without some connection to the land, whether that's, giving prayers for the food, that was just harvested or something like that. But let me see. I think I got the gist of it out. And so, yeah, really, it's just about, my work in climate change and health here with American Indian communities. And in Minnesota, I would say, notwithstanding the winter that we just had, that was like a non-winter. I think there are some things that are happening that are concerning, and for Indigenous folks here, I think about what comes up for me as an Anishinaabe person is, of course, our monomen or wild rice. And that's kind of being threatened or at risk in a certain way because of the warming water temperatures in our lakes, lower ice extents I've seen. And so essentially that is the ice is not on our lakes long enough or as a duration that it previously was. So it's like, how do you connect the dots? What are the issues there with those circumstances? But also, how can our communities, especially like our Native communities, really factor in supporting our ecosystems because of that interdependence, and particularly because of like sustainable practices like harvesting wild rice. And so, yeah, I'll pass it on. I think our next speaker is, I actually don't have the thing in front of me, so I have to rely on someone. Melissa. Okay, awesome. I will pass it on and take a drink of my coffee.
Perfect. That was both of you, both were so wonderful. These are both tough acts to follow. I kind of want to piggyback on some of the things that you were just talking about when you were talking about some upstream things. So my name is Melissa Thone. I am a DNP student in the Health Innovation and Leadership program, along with Pang, who's going to speak next. And we are about to graduate on May 10th from our DNP program. So for me, the focus, I know it's 18 days in case anybody else wants to put a countdown on their phone like I have. So for me, my role as a nurse and as a planetary health nurse, I see my job as a trusted messenger. Nurses, year after year, when there's a survey that's done about who are the most trusted professions, nurses win year after year. So I take that responsibility very seriously, that I am a trusted messenger to my patients and my community. So one of the focuses in our program is this idea of systems thinking. And when I think of climate change, I think of planetary health. I focus all of my work around that emerging field and that discipline. So it's thinking beyond climate change, and it's thinking a little bit beyond. I know a lot of folks from the public health sphere are familiar with, and now I'm blanking on the concept. What is it? One plant, one, oh my gosh, it's a Monday. I'm blanking. So
Is it One Health?
One Health. Thank you. I was like, what's the second word? This is how you know. This is how you know I'm a DNP student about to finish, where it's like, give me the word, please. My brain is swimming. So with One Health, it kind of goes one step a little bit further and talks about all of the connections and all of the relationships with all of the living beings on Earth. So I focus my work around the concepts from planetary health. It's an interdisciplinary field that's based in hope. So that's the other thing that I love about that too, is it can be really, really easy to get discouraged about this type of work. So it really is, we try to focus on the good things that are happening and the progress that we can make. So with this idea of systems thinking and with planetary health being a systems issue, and I think about sort of these upstream things as well. I always think of Desmond Tutu's quotation that we have to stop pulling people out of the river. We have to go upstream and we have to figure out why they're falling in the first place. So all of these issues, all of these systemic issues are so just intrinsically linked. So some of the specific projects and work that I have done, I also believe in the philosophy of not about us without us in any aspect. So my first year in the DNP program, the School of Nursing was looking at adding planetary health as a pillar to the program. And I actually worked with 3 other DNP students to integrate the planetary health education framework with the new standards of nursing education, to sort of merge those together and to weave planetary health into all levels of nursing education, from the undergrad, the master's, and the doctorate level. So I really, since we're speaking to folks from campus, I think it's really, really important that as students, as members of the university community, that you let leaders know in this space what you want and what you need. So that was our whole thing was, okay, you want to integrate planetary health as this pillar in our education. Let us tell you what we feel like we need to learn in this space. And then also, I currently work as an infection preventionist, and I'm really passionate about high consequence infectious disease and emerging and re-emerging pathogens. So a lot of my work too focuses on kind of where that overlaps with climate change. So I'm really passionate about that area. And then also with healthcare waste and healthcare emissions. Globally, if the healthcare industry was a country, we would actually be the number 5 emitter of greenhouse gases. And a lot of that comes from the supply chain. We use a lot of stuff, and we use a lot of single-use stuff, and we have to move it from where it's being manufactured and then packaged and then bringing it to healthcare facilities where we're using it kind of pretty wastefully as well. Dr. Beth Shank, who is a VP of sustainable practices with a system out west, the best way that she illustrates that is she uses a saline syringe as a metaphor. So if you think about this one-time use plastic product wrapped in plastic, and if you think about the lifespan of that one thing, where it had to be produced, it had to be packaged, it had to be filled, it had to be transported to a hospital, and then a nurse uses it once and then throws it away, and it's plastic, so it lives forever. And I'm currently, so that's kind of the metaphor I like to use a lot when we talk about healthcare waste, because to me, our job is we're supposed to be taking care of people. We're supposed to be helping people to get better, and we are causing some of the very problems that are making them sick with contributing to climate change. So my most recent project is that I am in the Climate Health Organizing Fellowship through Harvard. And 2 of my colleagues, Joe and Bianca, we are working to, our project is focused around the Minnesota Climate Action Framework, which has language where industries are called out. Sorry, my dog is barking in the background. Industries are called out and given benchmarks for their emissions reduction, and healthcare is not included in that right now. So our project is around a campaign to get that language added to that legislation. And I can put a link in the chat to, we put a website together with information about our project, and we've got a petition where we want to go to Minnesota legislators and ask them to amend that legislation and add it. But yes, gloves, all of those things, especially in infection prevention. We are in this mentality of one-time use. Things have to be used once, and that's the most that's the safest way to do things to prevent infection. And that's not necessarily the case. So it has to be people on the inside that are asking for that change. So that's probably like my biggest message to anybody is the message has to come from the bedside, whatever your bedside is.
Melissa, thank you so much. With that, we will turn it over to Peng, and then we will have some time for some discussion and questions.
Hello. Emong, I said hello. My name is Pink Fulor, and I apologize, but my camera isn't working this morning, so it will have to be off. I am a registered nurse, and my background is in home healthcare. I'm also a student at the University of Minnesota School of Nursing, and I'm in the Doctor of Nursing Practice and Health Innovation and Leadership program. My journey towards planetary health started at the beginning of my doctoral program in 2021. And the person who inspired me was my advisor, Teddy Potter. I find her to be a remarkable climate champion who possesses so much knowledge in this area. So in the last 3 years, I have been involved in a few climate work. And through these work, I have collaborated with nursing leaders, community leaders, and leaders from organizations like MPCA and MCAP. And these experiences taught me so much about teamwork. However, I also realized that something was missing. So we all know that climate change impacts many communities. And one thing that I noticed was that not all members of the community have access to information on how to mitigate these challenges. So coming from a Hmong background, my experience with the Hmong community, I realized that not many people understand climate change and how to protect themselves, which became a huge concern of mine because what happens when communities are left behind? Oftentimes, they become the most vulnerable to new challenges. And so, being a nursing leader, I asked myself, what is one thing that I can do to help this community out? And so, I decided to do some research. And because climate change was such a big topic and broad topic, I couldn't focus on everything. So I picked one area that I believe impact many Hmong communities because they still rely on farming. And so last summer, I found a tool called the Heat Education and Awareness Tool. And this resource was developed by agriculture stakeholders from the Pacific Northwest Agriculture Safety and Heat Center researchers. And they developed the toolkit to promote work safety. So if you look online, there are 2 different versions. There's one in English, and then there's one in Spanish. And the training guide goes over risk factors, preventions, treatments of heat illness. And so I use this tool as a guidance to make a tool that I can use for the Hmong community because I wanted something that was culturally appropriate and that they can understand. And so what I did once I created this tool was I provided education sessions to a few farmers. And as part of my research or my study, I carried out a pre and post test because I wanted to test the effectiveness of the toolkit. And after the education session, a lot of people show an increase of knowledge by 40 to 50%. So almost every individual who attended the session had an increased knowledge, which was something I was hoping for. And so the study provided me with a better understanding of the needs of the Hmong community and the power of outreach and education. So even after graduation, I want to continue this work and help improve the health and climate literacy of this community. And hopefully my work effort inspires other leaders to do something similar for our minority community in Minnesota.
Pang, thank you so much. I hope I put the right document in the chat. If not, feel free to put the correct one in there. Wow, such a wealth of knowledge from our four speakers. I'm sure that we could probably extend this session for another hour and still have some great dialogue. So at this point, I would love to turn it over to audience questions and dialogue. Like I mentioned, you do not have to raise your hand. If you don't want to speak, you can always add something into the chat and we'll read that out loud. But at this time, I'd like to turn it over to questions for our panelists.
Also, too, really quick, I don't know, Pang, I'm putting you on the spot, but I don't know if you have where you can link your video that you created. Pang did a beautiful video where she went and spoke with Hmong farmers and talked to them about climate change, and it's really, really beautiful. So, Pang, if you have a link that you could put in the chat so folks can see that, it's really incredible.
Thank you, Melissa, for sharing that. Yes, I can definitely link the video to our message chat. Hopefully it'll show. So give me a few minutes here to look it up.
Well, I will kick us off with a quick question because I have plenty. So I am wondering, I'm not sure if we have any undergraduates on this call, but if students were interested in this area, this intersection between health and climate change, kind of this emerging field of planetary health, what type of advice would you give students who are looking into a healthcare career and are interested also in climate and sustainability?
Oh, I could go. I think the issues that I see is that I think students would be really well prepared to um, um, just what's the right word to go into, but also just to go against is the idea of health, from like a Western perspective, is really centered on um, like human beings being at the top hierarchically, so I think just really investing and making efforts to be involved more in a career that centers our ecosystems, our lands, our other, as Native people, we often like think about these as our relatives. So there's so many species, populations of animals, non-human beings, I should say, that are really endangered. So it'd be great to see students go into, fields that really, I think, honor that perspective and center that perspective, because I do think that it's challenging to even explore opportunities to do really impactful work in the health fields for these intersections of climate change and health. Because there's reimbursement, third party payers that you're challenged by when you're trying to do this work, whether that's going outside, when you're doing healthcare practice. Oftentimes it's, the ethics challenge this work too. And so there's just so many barriers to doing this work if you go into a healthcare field, in my opinion. that it'd be much more streamlined and so much more liberating to do this from a, a different field. And someone, other folks had come in here and expand upon that, or, if that's offensive, feel free to come in. But that was my experience in healthcare. There's just so much red tape and barriers to doing any type of work with the environment. And I think maybe it's because there's such a privilege on, just unmitigated waste and issues with sustainability in healthcare, and I can't, say anything about the medical field, but certainly as a practitioner in mental health, it's like you sit inside your little box in your office and you provide, um, these treatments. And I can imagine it is like this for things like climate change, as you talk about eco anxiety and eco grief without actually being able to bring people outside, like Christy said, to have a garden for the patients, for the staff, and stuff like that, right? So that would be my kind of, I think, advice, having experienced, yeah, a lot of it.
Yeah, I think that's so well. Oh, go ahead, Melissa. Sorry.
Oh, no, that's okay. I was just going to say, kind of based off Carly's question and then what Cassidy put in the chat, and also Dr. Hill, what you were saying too. I just think it's really important, this idea of partnerships and meaningful partnerships. So my piece of advice would be find your people within your own discipline, but other disciplines as well. And seek these partnerships and seek the spaces where this work is being done outside of your own discipline. I actually last year started working with the Science Museum of Minnesota and partnered with them on an Earth Day celebration last year. We did it again this year. And it was something I never would have thought about, nurses and museums working together, until I did this work, where then you realize, oh, this is where these conversations are happening. This is a captive audience. These are folks who believe science and trust science and are looking for information on climate change and what to do about climate change. So that's really my biggest thing, is work transdisciplinary and interdisciplinary, and find your people. And just this idea of spanning boundary spanning leadership. So yeah, so now I'm a nurse that does work with the Science Museum, which something I never thought would be a possibility. And now it's kind of just keeps opening more and more doors for work that we can do together going forward. So yeah, find your people and color outside the lines.
Yeah, I would echo that. I think that's such a great point. And my experience was similar to what you were describing, Kyle, about just the training that we have being so individual, right? And it's so important to remember that people are within a context, right? The choices people make. And one of the best quotes I've ever heard was the choices we make are dependent on the choices that we have. And so if I'm advocating for someone to engage in active transportation, for example, to get more physical activity and to maybe bike commute, I need to remember that biking infrastructure is not distributed equitably across our neighborhoods. Our police data show that Black cyclists are stopped way more frequently than white cyclists. And the access to safe biking infrastructure isn't the same in all neighborhoods. And so when I'm advocating for an individual to engage in a particular behavior change, I have to also think about that within the context that they are operating. And if there are ways that I can go more upstream, like what Kyle and Melissa were talking about earlier, how can I use my privilege and my position to advocate for those changes where I have those spheres of influence? And because for a long time, my field of behavioral medicine was completely absent from the climate change and health space. It was really only the last 5 years that people within health psychology and behavioral medicine were even starting to talk about climate change and health. And so prior to that, I was doing exactly what Melissa said, right? I was working with my nursing colleagues, with my public health colleagues, with my medicine colleagues whose fields were like light years ahead of where my field was. And now my field is catching up a little bit. But I didn't let the constraints of my particular field stop me from doing that work. And so I definitely want to echo everything that Kyle and Melissa have said, and then maybe add in a piece too about recognizing that there are a lot of people out there who have been doing this work for a long time, and to not assume that you have to reinvent the wheel or that you have to come up with new ideas. Ask yourself and ask the communities that you reach out to and the folks that you are wanting to partner with, how can I give my strengths to the cause that you are already working on, and investing and helping in those kinds of ways, because I work a lot in the environmental justice space, and there are many communities who have been doing this work for decades before a lot of our fields even were thinking about it. And so using their expertise and their knowledge and lived experience to inform how you help and how you bring your strengths to this area has been a really important approach to doing the work effectively.
Thank you. Those are wonderful perspectives. We do have a few questions in the chat. I think we somewhat touched on Lydia's question. Or I apologize, somewhat touched on Cassidy's first question. Lydia asks about how our healthcare systems are kind of trapped in this Western ideology, Western-based solutions. Depends on those solutions for its success. How do we talk to our hospitals and clinics to advocate for more One Health-centered care?
I don't want to take up too much airtime, but I'm happy to speak to some of my experience with this after others have had a chance to share too.
Take up the airtime.
Okay, thank you. So just in my experience, the success that I have had, so I also do a lot of work with policymakers through the Society of Behavioral Medicine. And I think one of the most, and I'll drop a link to this in the chat. There are some really good guidelines out there about how to talk with decision makers about making these changes. And there, are kind of some ways in which you can shape your message to show that it's aligned with what their values are too, either as a hospital administrator or a policymaker. And so demonstrating to the folks who have that decision-making power that making these kinds of decisions are in their best interest, as well as would help sort of move some of their goals along that are in alignment with their principles and the values that and the mission, depending on the mission of the institution or the hospital. And then if you get into those positions where you have some influence, encouraging more representation in those decision-making circles as well. So if you have the opportunity to amplify someone else's work or bring someone else in who should be at the meeting or at the table when these decisions are being made, the more representation you have of the communities that are most impacted by these kinds of decisions, the more likely the decisions will include those perspectives. So I would say, I'll drop the link in the chat to the kind of the guidelines around how to shape your message, but then also thinking about how to leverage those positions of influence to advocate for more inclusive and representative decision-making power, I would say.
Thank you, Christy. Does anyone else want to touch on that question?
I'll just say it kind of reminds me of, I mean, my two favorite questions to ask kind of in this space is why. So when we were talking about looking at things from a systemic level, when you say, okay, so there's limited bike access in certain communities. Why? And then when you get the answer, why? And then that's how you get all the way upstream to then you go, okay, so this is what the actual problem is here, and this is what we need to focus on. And then my other favorite question is, what would it look like if? So the same thing. So what would it look like if we were having a conversation about these communities, and instead of just having them about these community members, we invited them into this conversation as well. So I like to back things up with why, and then also just what would it look like if we did this, or what would it look like if this is how things turned out?
Thank you, Melissa. A follow-up question, maybe for Dr. Hill. How is local Indigenous knowledge being used in conversations around public and climate health solutions?
Yeah, that's a really good question. So thank you, Cassidy. I think there are a lot of things going on that are really pretty beautiful with respect to how Indigenous knowledges are used, both locally um, and nationally, to be honest. And I think the first thing that comes to mind, because of the history of dispossession that has happened to Indigenous communities, and again, all of this goes into the inequities that we experience today, commonly known as like social and ecological determinants of Indigenous health. Um, but the first thing is like creating a kind of an ethical framework, and you want that backed up by policy to say, how do we guard against further um, dispossession, whether that's co-optation or cultural appropriation of these knowledge systems, because they are so local and like ecosystem specific, right? It doesn't make sense, for example, like if you think of global food systems, to distribute this very same knowledges across climate adaptation or mitigation programs, because it wouldn't work, right? So something that was designed, let's say, I love the idea of harvesting wild rice, for example, because that practice is rooted in sustainability. When if you were to use these knowledges that really govern that practice from our communities or Anishinaabe communities here, to take care of or restore or some other kind of water source in another part of the world, it wouldn't work. One, because they don't have wild rice. There's just all sorts of reasons, right? So keeping it local, I think that's the biggest practice, the biggest and most important kind of principle for this type of work. But I think about nonprofits are doing a large amount of that grassroots efforts. I know locally you have a place like Wakatipi, right, that's doing a lot of restoration efforts in what are kind of the traditional homelands of our Dakota community, out in Bruce Bento Nature Park, our nature reserve. And there are other opportunities locally where a lot of the kind of the sacred places for our communities are being, there's co-management applications going in or proposals with the federal government, whether that's like Bureau of Land Management or other national parks. And I think most importantly, when I think about movements, you have to give mention or credence to the land back movement, which is essentially everything that I talked about before. There's tremendous inequities in Indigenous communities, health inequities, and unfortunately, climate change really amplifies that risk, because those health inequities are essentially, there's a disproportionate burden placed on our communities as a result of that. And so the tendency for these grassroots solutions from nonprofit organizations within our communities, in addition to other more national, international movements like Land Back movement of folks. Communities are literally giving land back to Indigenous communities to be able to restore, to engage these traditional activities in ways that have served them time immemorial, right? And so I think those are some things that I really look at. But for my work and my interests, because of the sensitivity of a lot of these traditional knowledges, traditional activities, you know, I'm interested in creating like an ethical framework around the use of it. And I think University of Minnesota has done a lot of good things because we have research recommendations when you're working with Indigenous communities, and we're in the process of developing consultation policy with tribal communities as well. So those are a couple things that I would point to for that question. Yeah.
Thank you, Dr. Hill.
Mm-hmm.
So I have a question for all of you. I'm gonna get into this moment. So as the director of sustainability, I'm always working across the institution, kind of the center. Well, I don't like saying it like that, but of the wheel spoke and making these connections like this coffee chat that Carly has put together. But essentially, how can the university exemplify this interdisciplinary work for our own community as well as the surrounding Minnesota community? Like we have Center for Transportation Studies, we have planetary health, clinical studies, ecology. How can the university, or maybe you know of areas I'm not even familiar with, and I've been here just over a year, how can the university best exemplify this interdisciplinary need in this field?
Pull all those folks together.
Yeah.
And ask, I mean, honestly, like ask the folks from those different areas, not about us without us. So I would reach out to those different groups and pull them together and say, hey, how do we work together on this?
Yeah. And even just sort of like, yeah, like scaling up what Carly did today by having all of us come together in this coffee chat, right? Perhaps there's, you know, an interdisciplinary climate science forum or something that the university hosts where you invite people who are doing this work across these different disciplines and bring them all together on campus for like a summit or something like that, so that we can start working synergistically together and networking and finding ways of being able to partner with some of these projects so that we're kind of de-siloing some of the work that's being done. Pen, you look like you unmuted.
Yes. I was just gonna add on a few things that you guys can do as well as to have courses, provide courses or opportunities for other disciplinaries to come together and do research or just collaborate on a project, and I think that allows for networking, that allows for people to kind of learn from each other and their experiences.
Do you think your work is incentivized to be interdisciplinary?
Not really. I mean, that's a good question. I think the idea is there, because we've changed like tenure and advancement a bit. Some of the documents like this, we have a 710 document that talks about community-based participatory research. But I think, the metrics we use for success are very like individual based, and we don't have the opportunity I don't think it really champions or invites the community like we need to, if that makes sense. And I also think that there's an aspect, and I want to say this about for my own community, like Native community, there's a mistrust that also makes it difficult, because when you work for a university, it's very much like, oh, okay, so there's a processing that has to happen. And for those of us that know the truth report and stuff like that, there's very good reason for people to have mistrust going into relationships with university officials. And even for me, it's odd because I'm like, okay, like I'm a part of this community. I feel, my identity is more as a community member than as a researcher or a member or working at the university. So sometimes that's hard, but I think what's promising is like the work in climate adaptation, planetary health, climate mitigation is really centered on the idea of interdisciplinary and multidisciplinary teams. And so, but it's easier said than done, because when I find myself saying, like, which is often, I don't know how to do this. Like, I don't know how to work with early warning systems for climate adaptation or, risk for climatic events. And, of course, we have solutions like, okay, I got to go down the hall, or I got to go to this person or that person, or I don't know how to, do some of this work. So I would like to see, you know, I think someone had mentioned it before, whether that's a forum or something like that, like an investment on behalf of the university to really look at creating interdisciplinary, multidisciplinary teams regionally, nationally, and in a, this might be too much to ask, but in a non-competitive format, like grants, all that stuff, you feel like you're one of 1,000, and that's really tough because you're like, all this stuff needs to get done. Why am I competing against someone in, Florida, or why am I competing against someone in Baltimore for very serious, like, local climate related issues? And so, yeah, those are a few, I think, things that I think need to change for us to really do transformative work, or at least kind of some shifts that need to happen. But I do feel like the metrics, all the things really kind of silo us off, and it's and I think it's just systemic and institutional to break out of those silos.
Thank you. Thank you, Dr. Hill. I just appreciate your real reflection. That's been my challenge. I've worked for higher education for almost 20 years, and I want to make sure people are compensated for the work that they do. You're here for an hour, which is wonderful. I would love to do larger forums, but I have to think about, like, how are you incentivized to do that? How does that work within, your framework as a professor or someone who's working in a clinic or something like that. So I'll just put a little shout out. We've been building off of our climate action plan to ask questions. I love when, Melissa, you just said why. I'm like, oh my goodness, I do that all the time. It gets you upstream. But essentially we're laying out research questions that could be deep research, but needs to be funded, or internships, capstones, and we're about to present some resources online. But I would just welcome you to join, all of you to join in that conversation. We need to, like, do this work and make with the academic community very deeply involved in helping us understand what the best choices are.
Yeah.
And
go ahead, Kyle.
oh, well, I was just going to say, to wrap that up, I mean, I think to your point, like asking why, I find it so tremendously beneficial to look at the disparities that the systems or institutions and their approaches are kind of complicit in. I love to see that type of work being done. So for example, the majority of philanthropic monies go towards like white majority communities or nonprofits, right? And so what that says is that indigenous nonprofits are getting very little despite these huge issues like climate change. And so that is one kind of example of some work that really needs to be done, I think, institutionally. Like, how effective is NIH in helping these interdisciplinary kind of sources of like magic spring to life with people that are applying for these NIH grants? Like, how long is it taking? Are there any that have actually, like, borne fruit? And why is that? Again, going back to this question of why, I would, just off the top of my head, I would say, like, I would love to see some case studies of, like, how long it took an interdisciplinary team to be developed, to apply for an NIH grant, to actually do the work, whether there was like restoration or like ecosystem specific, like climate adaptation work, you know, and what were the results of that? I wonder, this makes me sound like my daughter watches Sesame Street. I wonder, you know, I can imagine it would take 5 or 10 years to do something that like a nonprofit would do in 6 months, you know, and even maybe even longer than that. And so I guess what I'm getting at is like, how can we call out some of these systems, you know, with a very like the acute need to do some of this stuff without getting into like the gloom and doom of climate change? It's like some of the stuff, you know, can we just do it faster? You know, is there a way to do that in academia, which is a long-standing, I think, issue. But I think that creates, you know, that's the need for partnership too, is like partnership with nonprofits or whatever. But anyways, I'll stop there. I just want to say thank you. I know we're coming to time.
And I'll just add, you got to include the students. You have to include students.
Exactly.
Thank you all.
Wonderful. Well, a massive thank you to our 4 panelists. You guys are doing such valuable, incredible work. I feel like this is just the start of such a larger, broader conversation. So thank you guys for being willing to speak today, and stay tuned. In the fall semester, we'll be picking up this coffee chat program again, and I hope to see some of you there. This session will be posted on our website, and I might see if there's some way we can share some of these links out as well. So thank you all so much.
Thank you. Happy Earth Day.
Happy Earth Day.
Happy Earth Day.